Again, the school board meeting will begin in 1 minute.
Good Thursday morning, everyone. As we are on the cusp of beginning a new and exciting school year, before I read our commitment statement, which I believe pertains to every single one of us, our kids, our families, our community, I just wanted to give a shout out to the full house that's here today and probably a lot of folks watching in the community. Thank you very much for being here with us and for partnering with us. We are the Marion County School District Leadership Team. When we come together to work, we are efficient, effective, and productive. Our three most important characteristics are dedicated, transparent, and individually responsible. To work well together, we must demonstrate respect, confront reality, and be accountable. We will always put students first, and we will leave a legacy of success. That's for all of us. Okay, we will begin with reminding you to please silence your electronic devices, and I now ask the school board attorney to explain the rules for this work session. Good morning, Attorney Powers.
Thank you, Chair Thrower. This work session is a public meeting as defined in Florida's Sunshine Law. The board is dedicated to full transparency in its meetings and its work. In compliance with the Sunshine Law, the board has adopted uniform meeting procedures, including the right for citizens to participate. The board will allow public comment regarding any work session item listed on today's agenda at the appropriate time. Speakers must fill out a request form and hand it to the school board secretary. After the board and superintendent have completed their discussion on a particular agenda item, the secretary will call speakers' names in the order received. At the podium, speakers are asked to state their full name and address, and to spell their last names. Each speaker will have 3 minutes. As required by the Sunshine Law, the board must maintain orderly conduct and proper decorum throughout the meeting. Speakers may criticize subject matter and decisions in a respectful manner, but not people. Finally, speakers must be very careful not to violate the privacy rights of others, especially students and their family members, by mentioning their names or other identifying information. Thank you for your attention to these important rules.
Thank you, Attorney Powers. We will now begin the work session with the superintendent's administrative briefing. I did just want to point out that because of all of the folks that are here today and to honor their time, I'd like to move the school planning update to right after the COVID-19 updates. So we'll have the Reddick Collier gym update after the school planning update. Thank you. Good morning, Dr. Gullett.
Good morning, Madam Chair, members of the board. Pleasure to be with you this morning. A few items to share. The first is just want to announce for the public, we moved item 2022 renewal rates, the self-funded health plan item, to a later work session. The presenters were unable to be with us today. Multiple presenters were not unable to be with us today, so we took that off today's agenda. We'll have that at the next work session. I also I have the pleasure to introduce our new Chief Academic Officer. If Margaret Talbert Irving would stand. She's back there in the back. We have a full house. Some of you have had the opportunity to meet her already, and she is just a great asset and a welcome addition to our team, and is out visiting schools and departments and working hard already. She has a great background in turnaround and has been a principal for a number of years and an executive leader. So very humble, very approachable, and I think that she'll be just a great addition to our already fantastic team. So
Glad to have you on board, ma'am.
I would also like then now to bring forward Mr. Knight to provide our regular updates on the Howard Academy, as we've been doing each work session. So welcome, Mr. Knight.
Okay. Good morning, all. Ladies and gentlemen of the board, Mr. Powers, Ms. Prespatino, and Dr. Gullett, good to see you all this morning. Bringing you an update on the Howard Academy project. As you remember, we have a project out there to replace plumbing and restrooms and rotting floor joists. The first step was to go ahead and take out any asbestos that we had in the building, which mostly consisted of insulation around the piping. That has all been done and completed throughout the building, not just in the bathroom areas, but we took the opportunity to rid the building of remaining insulation that we found. All the demolition is also complete, which mostly is cut out all the floors and cut out all the walls so we can access the old piping and remove that as well. And Monday, we start framing back the floors and the walls and setting the piers underneath the building so that we can set the new floor joists on top. And in addition to Monday's work, plumbing is also going to start underneath the building. And rather than take the plumbing out and come back later to put the plumbing back in, what the plumber is going to do, because it's such a tight fit, is once they're under there, they want to stay under there until complete. So we'll be moving the piping section by section and installing the new piping right behind it section by section. We're also going to install a temporary water line to keep the other two buildings fed with water while we go out and take out the old plumbing system campus-wide. The board will have a forthcoming price approval request to do the campus plumbing. Right now, we're of course focused on that main building, and that second piece of it is the campus plumbing. We are still on target for September 15th, finishing the entire project and getting everybody back into their spots, and business as usual from there. So unless there's any questions, that concludes my quick update on Howard Academy. Big work, but only said in a few sentences.
My birthday's going to be extra special this year.
All right. We'll have to have you break in the new building or something.
You bet, you bet. Board Member Cummings, was there anything you needed to add?
Thank you.
Okay. Thank you all.
Thank you.
So one more item I would like for Miss Boston Ellis, if she's back there. She doesn't know I'm going to ask her to please stand. She doesn't. Another humble leader that we have in our midst. Our school district was recognized for the 21st consecutive year, and thanks to Miss Boston Ellis and her team for winning the National Finance Award for Transparency. And
Thank you for keeping us solvent.
yes, thank you and your whole team. So thank you. And we have some special guests that will be introduced during our agenda item. So that concludes my
21
briefing.
years?
What's that?
21 years in a row?
21 years in a row. That's correct. Yes. Thank you.
Okay, wonderful. We will move right along then to our COVID-19 updates, and I notice it no longer says on the agenda if needed. We just Good morning.
Good morning. Good morning, Board Chair Thrower, Vice Chair King, board members, Dr. Gullett, Attorney Powers, and Ms. Nicole Prestipino. We are pleased to be here today. Summer school programs all ended last Thursday, July 15th, with the exception of our VPK programs, which actually end today as their last day at the VPK sites. Our overall attendance rate for summer schools was 79.36%. That's a pretty nice rate for your summer school programs. So we were very pleased with that. And I can't shout out enough thanks for our teachers, our non-instructs, our administrators that were at the schools, our content area specialists, and several of them had student service managers as well. Their complete dedication for our students this summer to continue that extended learning and summer school learning was amazing, and we truly thank them. We did have some extended learning that was offered at 9 of our sites during the summer as well. 259 students were registered at those 9 sites for the extended learning that lasted until about 5:45 in the evenings. Some of those activities that were in the extended learning time included readers theater, we had an embryology program, STEAM activities, and even some of them had the Crazy 8 Math Club. We were excited when we would go around to some of those extended learning sites. Even late in the afternoon, the students' minds were engaged and they were active in their learning. We can share some preliminary data with you from summer school. For 3rd grade summer reading camp, 5% of our 3rd graders taking the SAT 10 for promotion passed this assessment, which allows, of course, these students to be promoted to 4th grade. This is 2 percentage points higher than in May of this year. It is 3 percentage points lower than last July 2019 data. This summer, 5% of our 3rd graders also passed by portfolio. A portfolio assessment, that also allows them to be promoted to the next grade level. The 2019 percentage of students who passed with a portfolio was 6%, so down by 1%. However, certainly with students being out during the school year, some of them had more standards to cover during the summertime and to recover that. So we were pleased with our 3rd grade data. Our secondary students were able to recover a total of 2,420 course credits. And this resulted in a grand total of 39 additional seniors being able to graduate high school. So that's pretty amazing. Again, I can't thank our staff, our teachers, all of our school-based staff that were dedicated to the commitment of our learners for Marion County Public Schools this summer. They basically will have had maybe a week off, 2 weeks off. We tried to be very flexible. Some of them came in and co-taught for 3 weeks, and then their partner came in and co-taught the other 3 weeks. We did whatever we could to honor their time because we appreciate their dedication to the programs and to the students. So that's where we're at with summer school for our update. Moving into the Instructional Continuity Plan, the ICP. As you know, the Innovative Learning Model did sunset for the upcoming school year. And of course, that's in accordance with Department of Education guidelines. We are hopeful that the students and staff impacted by COVID-19 this year will be few in number. However, we know that Marion County Public Schools still needs to have a plan to help support our students and their instruction in the event that learning could be interrupted. The Department of Education realizes that and has awarded each district grant funds to create this instructional continuity plan. As part of this process, you'll remember last year, a little earlier than this time, last summer, actually during the spring, a year and a half ago, we were developing in our district our own instructional continuity plan, and we were reaching out to other districts for advice. Now the DOE has hired a consultant group called MGT Consulting Group to help districts put together their instructional continuity plan. We've been meeting with these consultants. They have visited several Florida districts to learn about the types of remote learning that were implemented this last year. And basically during the shutdown of March 2020, when we first began the pandemic. MGT Consulting Group then took all of this data and all of this information, and they've developed a framework and guidelines to help support our districts creating their instructional continuity plans. So we will be making ours stronger in accordance to Department of Education and the MGT Consulting Group's framework. These trainings are occurring actually today through a webinar, and the technical assistance portion is also going to continue during the week of August 23rd. It's expected that during today's webinar, districts will hear, of course, about additional requirements that will need to go into the instructional continuity plan itself. However, behind the scenes, Marion County Public Schools ICP team has already begun meeting, and we've already developed that initial draft framework. Teachers will be able to upload lessons and assignments to their respective technology platforms, which of course is Canvas for secondary. It's continuing to be Microsoft Teams for elementary. And then elementary students would be sent home with a resource packet to help and assist during instruction. Not a resource packet of worksheets, but a resource packet with guidelines that walks them through how to access their platform, which would be Microsoft Teams in elementary, Canvas in secondary. Of course, students that need a device would be issued a Chromebook right away should instruction become interrupted. We will also have Homeschool Liaisons, thanks to our ESSER grant funds for each school campus this year. A big role with the Homeschool Liaison will be, at the elementary and secondary level, will be to engage with our families and our students by making contact during any time that they're out for an extended period of time from their campus. Once we attend today's webinar, we fully expect that we will certainly understand the parameters required in this ICP framework, and then we will have our instructional continuity plan team reconvene and certainly build off of their work and include any additional guidelines that Department of Education is then giving us to review and revise this plan. This ICP plan is required by Department of Education to be submitted by the end of September 30th, 2021. So during our next board work session on August 5th, we will come to you and share an updated draft of our instructional continuity plan that we are developing during our regular COVID-19 updates of that August 5th work session. So lots of work being done behind the scenes, continued webinars with Department of Education to really get the rest of the framework and guidelines, and we'll have that put together with our team and the stakeholders to share with you on August 5th.
Thank you, Ms. Keinert. And I do have a couple of clarifying questions, because I'm an educator and that was a lot of jargon between the ICP and the MCPS and the MGT. And so just to make sure that the community is clear, I'll start with the number. What was the average again, for attendance for summer school?
79.36%.
Oh, so we can't round it up to 80, really. Because, 79 is a C, 80 is a B.
That's why I thought it was important to add that, but I couldn't.
Right. Yeah, we have to be honest. Okay. All right. And how was our summer recovery funded?
So our summer recovery was funded through multiple sources of funding. The main source of funding was our ESSER funding dollars that were provided to continue that student learning, to really recover any academic loss and instructional loss during the pandemic.
Okay.
We also had some additional funds that were provided with schools through their Title I dollars. Some of them utilized TESA funds. There were some little grants that were in there, but our major one would have been ESSER dollars and then some of their district school-based Title I funding.
Okay, and again, for clarification, the ESSER dollars were dollars that were provided to us knowing full well that our students did not have the access to their education that they typically would have had. And that money has to be spent quickly and only on certain things, correct?
Yes, absolutely. And just in the same way last year where we were able to implement before school and after school tutoring sessions quicker, we did some virtually for parents that couldn't bring their students in that were still on virtual, but for our students that were in brick and mortar, we were able to enact the tutoring earlier. We wanted to have the summer school run as long as we could in the summer to recover that learning loss.
Okay, all right, thank you. And then I think the community is pretty familiar with the term MCPS Online, and so that is no longer going to be available because we no longer have funding from the innovative learning model.
Right, so exactly, yes ma'am. So the innovative learning model is no longer supported by Department of Education.
Okay. All right. Thank you, because I know there is concern in the community. There were kids in outlying areas that didn't have the same access. And even though we provided computers, which was wonderful, there's still just a box if they don't connect to anything. So I did want to give a quick shout out to Ocala Fiber Optic, yes, and Mr. Poole, because he's doing a huge service to the community to level that playing field for all of our kids. Okay, and then my final thing was Homeschool Liaisons. Those are paid for through ESSER funds.
Those are absolutely paid for through ESSER funds. And again, that person will be vital in that basically conduit between the school level and the families and the students, so that if instruction happens to be interrupted, right, we hope that we won't have a COVID-19 impact any of our students or families this year, but if it does happen, we want to have a plan in place, and those homeschool liaisons will be vital for us at the school level. Principals have been hiring those positions. Most of them are hired now already. They're being trained, and they will be able to communicate between the schools and the families and making sure that the students have everything they need to continue the learning if they're at home.
That is great, and that is vital. And I just have a suggestion. It's probably too late, but for me, thinking in terms of just being a citizen, homeschool liaisons, that sounds like we're helping kids that are being homeschooled. So I don't know if home education liaison, I don't know. But to me, that's a little bit confusing, but it may be too late to change the title.
School liaison.
Yeah,
And just take the home out.
school home liaison. Because that's what you're really doing. I don't know. Just food for thought. You guys are amazing. I can't believe how much you pulled together in such a short amount of time and how successful it's been, but there just was a lot to unpack there.
And I will speak to the job description. So we have a job description currently for homeschool liaison, and so speaking of being able to enact quickly and appropriately, we felt that the duties would be able to fall in line with that, but we can certainly take a look at that moving forward with a future job description. Yeah. Thank you.
That's an aside. Thank you. Appreciate all your answers. Anybody else? Okay.
Moving right along.
Moving
All
right
right.
along.
Dr. Hammond.
So, thank you. So the next topic that we want to talk about under COVID-19 is the reopening of schools and the mitigation strategies that we will be using this school year. We need to have that conversation, right, to see how we're going to move forward for this coming school year. We know that this past year was a very different and challenging, but also a learning year for us. And so throughout this year, we've learned a great deal about mitigation strategies, in particular, some of those hygienic and disinfecting strategies. I'm actually going to pause here and turn it over to Ms. Dobbins to share some of that for you, and if you had any questions regarding those, and then I'll come back and share some other items.
Thank you. Good morning, everyone. I'd just first like to pause before we talk about next school year and recognize our custodians. We didn't close one school, one department, and those custodians went above and beyond to ensure that our schools and departments were disinfected all last year. And thanks to their work, we were able to stay open and move forward. So as we talk about opening our schools this year, a reminder, our custodians were on summer cleaning, so they did all the deep cleaning of all of the schools, which is a monumental task, and they've completed that, and we are ready for the opening of school. I emailed each of you on Monday all the steps that we have taken to address our departments and our schools in preparation. I would just like to, before we open for questions, highlight a couple of things. So I attached the nice color copy of what our red proxy bottles look like. In addition to our proxy bottles, I wanted to publicly note that all of the solution in those bottles lasts 21 days. All of those solutions will be dumped and refreshed, and then an expiration sticker will be added to every bottle. And part of the checklist for our custodians is to check that those bottles still remain in the rooms and that the stickers are checked so that they are refreshed and ensured the refreshing of the solution every 21 days. So that is something we just wanted to be more transparent about. So if a teacher picks up their bottle, they can see exactly when that solution is going to be refreshed next. The other part is in the email, I noted that the Proxy H-Dox is also on the EPA list to kill the new strands of the COVID. So I wanted that to be publicly acknowledged that our solution does work on the new variant. With that said, after the email, after you've had time to read, do you have any questions for our custodial staff?
Just tremendous kudos all the way around. I mean, schools, there's just so much to keeping them clean in a typical year.
Thank
I did
you.
have a question about that. Those chemicals, will they also be available for transportation as well?
They're available for
Same
every
process.
school and every department. So thank you for that. All of our procedures and processes that we did successfully last year to keep our schools and departments open remain in effect.
There's also some special spray for the buses I read about in your email that creates a barrier.
Yes, that is the Omni, and if you read through each department, so for example, they'll go in and they'll spray all the buses with the Omni Shield, which will last 3 months, and then in 3 months we'll spray them all again. And then we're also doing those things at school, so we're spraying locker rooms, wrestling mats, all of those high-touch areas will have the Omni Shield applied, and then in 3 months, 90 days, we apply it again, and that's been ongoing. That's actually the things we've been doing from last year.
Okay. So in addition to those mitigation strategies for the hygienic and disinfecting things, those all helped us not, be able to keep school open. One of the other things that we did last year was we developed a great conversation with the local Department of Health, and we are planning on continuing those regular conversations throughout the school year to help our success for this coming school year. As the next school year approaches, today we are seeking guidance in 3 particular areas. I'm going to take the time to just give you a high-level summary of those 3 areas, and after that I'm going to actually turn it over to Mr. Landers so he can also give you an update from the Department of Health as well. So the first area that we're seeking some guidance in is that this past year we really limited the use of communal spaces and cohorting of students. And additionally, students also used their own materials, so they didn't share materials, and we implemented social distancing. These strategies all helped mitigate the spread of the virus, which was great, but it also impacted learning in various ways, right? So as much as possible, we want to continue those practices. However, we also are committed to providing the best learning opportunity for students. And so it's our recommendation to resume as much as possible a typical school function and running and use of those communal spaces, while as much as possible implementing all of these mitigation strategies, including social distancing, as much as possible. So that's that first area, is the use of communal spaces and cohorting. The second one is, as you know, we limited volunteers on campus, we limited visitors, field trips, we limited gatherings and events, which includes athletics and fine arts. These events, as you know, are all voluntary for people, meaning that they can either choose to come to these events or they can choose to have their children participate in these events. Thus, we're recommending that we permit these events, knowing that these are choices made by those individuals that are attending. But again, we're still going to continue those great mitigation strategies that we've learned this past year. And then in addition to those final 2 areas, we're also seeking guidance on the future of the face covering policy. So we know that face coverings were made optional for the summer sessions of summer school. And I just want to remind you, I think you also received a copy of the School Health Administrative Resource Manual. That manual was revised this year, and that provided guidance to school boards on the mask policies or face covering policies. And in that manual, it states that mask policies should be voluntary, since the risk of infection in children is less than in adults. And the other reason that they recommended that mask policies should be optional is because now the vaccination is available for those persons ages 12 and up. At this time, I'm going to turn it over to Mr. Landers to share some local information from our Department of Health.
Thank you. Good morning.
Good morning, board members. Superintendent Gullett.
Would you like to sit? Share. You guys want to sit?
Oh, sure. Why not?
You don't have to stand.
Probably need to stand. How's everybody this morning?
Great.
Awesome. I'm going to share a little data. And first of all, again, kudos to the schools. You did a fantastic job last year of keeping the schools operational, not having to shut down anything. And I think that's, and I know from your job, this is Ms. Conklin. She is our epidemiologist, head epidemiologist over our immunizations, basically our disease intervention program. So she does intimately involved with everything that has happened in the schools and with our contact tracing efforts. So I want to go over quick a brief community outlook of where we are right now. We're seeing in the papers across the nation and across Florida, and even in Marion County, increased cases. We've seen this over the past reporting period. We had about 650 cases over a week period. It was an infection rate of about 14.7%, which is, we're back above 10%. We were at 8% the week prior. But the important thing there is we're looking at cases on an average of about 175 per week per 100,000. Let's take that into comparison to the same time last year in July when we started seeing those increases. Our positivity rate was a little lower, but we had 244 cases per week per 100,000. In other words, we were testing more last year than we were this year. There was more actually testing going on, which could lower that, the positivity rate. And also compared to our spike in January that we had after the holidays, at that point we were at about 1,900 cases a week, and we had an infection rate of 17.7% positivity rate, but we also were seeing about 520 cases per week per 100,000. So you can see there's some lines that follow along. Yes, we have seen the spike. Has it topped where we were this time last year? No. Has it topped where we were in our greatest point, January? No. It's something that we would expect to see. Summer months, there's more travel, more opportunity for exposure, so we've seen those numbers. Some good news on the vaccination side is we've now vaccinated almost approximately 170,000 of Marion County residents. That's over 50% of our eligible population, which is our 12 and up. And it's over 45% of our total population in the community with regards to how many people have been vaccinated. Those vaccines are readily available throughout Marion County, whether at the health department, the federally qualified health centers, the CVS's, Walgreens, many opportunities for individuals to get vaccinated. In fact, we're doing a school event it's a back to school event at the mall on the 31st of this month. And we're going to be set up in one of our old locations where we were there offering your standard back to school vaccines. But if any individuals of any meeting that age group of 12 and up are, we're looking to be vaccinated, we'll be offering COVID there as well. So there'll be an opportunity at that point to offer more vaccines. We talked about the mitigation strategies. Of course, going to the CDC guidelines, vaccination is their leading strategy against mitigation against this virus. We do reference the mask use with CDC, still recommending individuals who are unvaccinated over the age of 2. If they're going to be in a space that cannot be socially distanced, the recommendation is to wear a mask. Try to fit in the physically distancing as much as possible. Screenings to identify cases, that's something that we will continue to do at the department. We set that time aside specifically for school boards and the school members, staff, and children where we vaccinate we screen over at the health department and test. And those were to try to identify if we have cases quickly. If they're a case, then we can move on and Kelly's piece can take over with the contact tracing and trying to eliminate the spread of that virus further. And those plans are in place for the upcoming school year. We will have designated times for the school staff and students to be tested to continue that process. We feel that's worked very well over the last school year. We talked about areas of mitigation strategies, ventilation, having good ventilation in the schools, keep promoting the hand washing and respiratory etiquette, cough and cover, staying home if you're sick. We still see that as a big issue in our adult population, and it needs to be maintained throughout the teachers, your staff members, and the students as well. If they're sick, stay home. Whether it may not be COVID, it may be something else, it may be flu, but they still need to be at home until we can verify that it's not COVID.
Mr. Linder, will you please say that again?
Stay home if you're sick.
Employees?
Employees and employees, all employees and students, and I know that it's hard. I'm not a teacher, but I talk to plenty of them, and I know they're so dedicated. They're dedicated. Your teachers are dedicated. They want to be there for the children, and so what may be a small feeling. I don't feel very well today, but I need to be there for my kids. It needs to be stay home until you feel better. Stay home. If we need to test you, we'll test you. Let your substitutes take over for you. But I know it's definitely a dedication that's hard to work through from a teacher's side. But in the long run, We have seen, specifically in our adult populations, individuals going into work sick and transmitting it to other individuals at work. So it's an important message to put across. The contact tracing piece, I can't say enough for Kelly's team and what they've done, but we've kept those efforts beefed up. One of the things that happened was, as cases started to decline, staff members around the state were, and these contact tracings may have been let go. We didn't do that. We kept our staff on board in the event that we would see something like this over the summer months and then moving into our school years, to have that contact tracing available for quicker results. And then finally, the cleaning and disinfecting. We've all discussed that how important that is in the schools, and the mitigation measures you all have taken to limit the spread of the virus. I think I would like to highlight the comments that were made. We do have our meeting. We have our meetings that we stay in touch. It's almost like we're the school board east and y'all are the Department of Health west. I feel that way sometimes. We're that, we do. We stay that connected, and by being that connected, has allowed us to be efficient and effective. Relatively, maybe at first we had a situation, well, hey, if you know this is going on, well, now I do. But now, by the time we all met and talked, we all know what's going on, where we need to address. There may be situations in the upcoming school year where Kelly identifies that we've got 3 or 4 cases that we're looking at in a specific classroom, and if it's an outbreak scenario, we look at implementing additional mitigation strategies in that classroom or at that school, above and what's beyond. But that would be a recommendation made. But I would think, if you want to talk about the contact tracing piece, how that works, and that way everyone's familiar with.
Sure. So basically what happens for us is when we get a positive case that drops into our system, so it's called Merlin throughout the state, we get positivity results through that system. We're able to get demographics from that positive person, be able to interview them, gain information such as contacts, where they may have been, can we link it to an outbreak, that kind of thing. We're able to get all the contacts information as much as they have, and be able to start contact tracing from there. My staff are very, very, very good at investigation. They're very savvy. They're very internet savvy. They're very social media savvy. So for people that don't have their Facebook on private, we're gonna find some stuff out. So, which is how we find a lot of different contacts and are able to put people in quarantine that need to be put in quarantine. So with that regard, for the school system, we are able to then relay that information to your school liaisons, which may be your principal or a designee at each school, that is able to relay that information to whoever they need to at the school to say this child should not be at school, this child can return on this date. And staff members as well.
And I think the school health liaison piece has been fantastic, and it's worked really well because it's helped us modify our process. What we may have started in August of last year might look a little bit different than where we ended in May of this year, specifically with the way reporting at the end of the day. And that's the feedback that came back and forth from the liaisons to the health department and to our staff. There was constant feedback, and then, well, this seems to be an issue. How do we resolve it? And it was getting together with the liaisons, getting together with our superintendent and the meetings that we would have, and working through those. That has been such a huge part of Marion County, and we definitely, as we spoke about, that is not going away. But that's going to be vital for Kelly's part, as well as the school when it comes down to quick identification, quick contact tracing. Get the kids back in school that should be back in school, and those that are sick and out that need to be on an isolation. We can work with that as well. So that's a little update. Now, I'd be happy to answer any questions.
I got a question. What's the fastest age group of fastest growing in Marion County as far as positivity?
What we're seeing now is we are seeing it, and you'll see it, you can vouch for this, in our 0 to 18. Not many of them have been at school this year. I think you're finding a lot of those were out in the summer programs. The age groups where, when I get the reports I'm looking at, is probably in that 30 to 40 age group, the 25 to to 40, 44 age group. That seems to be a lot of our positive cases are coming through those. It's almost like if I've told somebody the other day, it was looking like at a bell curve. When you look at it, it's just that population seems to be the population now that's being most effective with positivity.
And earlier this week, there were some recommendations that came from the American Pediatric Association. I didn't hear anything mentioned about it.
I think it was the same. That was the same recommendation as what you're talking about that came from CDC. I think their recommendation was 12 and up, or excuse me, 2 and up, unvaccinated. There's a recommendation if you're going to be in crowded areas where you cannot be socially distanced to wear a facial covering. I believe that was the recommendation you're speaking to. And it's just, you know, if you're unvaccinated, then there's still that potential for exposure. And you know, as we see with, like I said, with the summer months, everyone's out, everyone's moving. You're traveling outside the state, you're coming back in, others are coming into the state. So it increases the opportunity for exposure. So it's not surprising that we see these increases.
How did we do in terms of within school transmission?
That's a number I want to get you because they're still doing some of the final calls and working on that data, but I will get the school board the data to let you know how many we had in that age group and how many were actually in school. Okay.
I had a question specifically about quarantine. So as we're talking potential future, is the quarantine period still 14 days?
The quarantine period is still 14 days per CDC guidelines.
And is that still if you have your mask with or without a mask? How's that?
The difference would be, and correct me if I'm wrong, vaccinated, if they're vaccinated and they were identified as a close contact, they would not be a close contact unless they're symptomatic. And the other piece to that is if both the symptomatic and the contacts were in a mask, it's down to 3 foot. The way it's worded in the CDC guidance, that if you have an individual who was identified as a positive case, but they happen to be in a mask, and any individual that was wearing a mask around them at time of exposure, it would go down to 3 foot as opposed to 6 foot.
And then there was something about getting tested, and if you were asymptomatic, you could come back sooner.
That hasn't been developed yet. I know there's some studies going on outside the state that they're looking at. It was a test and return, but that has currently not been developed in Florida.
Okay, yeah, I've been doing a lot of reading.
Right, there's a lot of practices that are being looked at outside the state that we look at trying to see if it can be implemented within Florida structure.
Okay, all right, thank you.
So then the guidelines is that if a person is not vaccinated, if they're going to be in close quarters, that they will still need to probably wear a mask, correct?
Well, it's the recommendation from the CDC. That's just a recommendation, and I think that goes back to it's looking at that school health resource guides where it specifically states out that it's a recommendation, and it should be voluntary, not mandatory within the districts according to those guidelines. So, but I think our recommendation is if you're unvaccinated, you're over the age of 2. And you're going to be in areas that cannot be socially distanced, and the recommendation is you can be in a mask.
And the thing about the national recommendations, obviously, we still have a number of states that never actually had full-time school at all and haven't had kids in school since March of 2020. Right. So we still have, when you're looking at these national recommendations, obviously they're trying to get kids back in school. So I can understand that completely from the national perspective and why they're trying to mitigate concern as to kids even becoming, back into a school environment. Whereas we in Florida, we in Marion County have seen success with in-person learning for our students all throughout last year. But it goes back to the point that you were mentioning, and if I'm not mistaken, so correct me if I'm wrong, I'm not a health professional, but the reason that the mask is effective is because a student may not be practicing proper respiratory mitigation. So they may not be coughing or sneezing in their arm. And that's what actually is protecting that spread, because essentially that is still how it spreads. It spreads with hygiene and
it's droplet.
Coughing and
goes
sneezing.
into a mucous membrane, so eyes, nose, mouth.
Right. So coughing and sneezing, if we are teaching proper hygiene, teaching proper respiratory mitigation, then all of our students, regardless of their age, if they're doing that, and that's the way we're training.
Lowers the chances.
That is a mitigation practice.
Yep.
The hand washing and respiratory etiquette is a standard mitigation practice per CDC.
Thank you.
Anybody else? Now's the time.
I had a question actually for Ms. Dobbins, I believe, and it may just be a rough question, but when we're talking about one of the recommendations is the communal settings, that, and one of those locations that has not been, we haven't had as many students in cafeterias. I know we had a lot of, some in our high schools eating in gymnasiums and everything, because the cafeteria spacing was not what it had been. This Omni Shield that's going to be used on buses and is that also, we're putting that in cafeterias and that may have been something we did last year, but I just know if we're talking changing our communal procedures, eating in cafeterias closer together is going to be part of that process. So can you speak a little bit to that?
I do believe so, but I will get a definitive answer to you and reply to the whole board for that.
Okay. I'm not sure if Omni Shield is
not,
food grade. I don't
as
know.
we talk about that portion, if that's a need, then we absolutely will do it if we're bringing our students back in to communal areas.
Sure. Okay.
And then going back to the fact that we will not have MCPS online this year, correct? So therefore, we're going to have more students back in the classroom, back in our schools. That means less space than last year as far as for social distancing, as far as for going back to the cafeteria. We still plan to do meals differently than we did last year with maybe eating in class. Because I'm not seeing how we will be able to, and that's not y'all question, Mark, I'm sorry.
Yeah, maybe we should finish up with Mark and,
No.
yeah, let's finish up with Mark and his team first.
To that question, and I'm definitely not my question, but I was looking at, dining, some of the issues, not issues, but some of the recommendations with dining is, of course, maximize your seating if at all possible. But then, the area, it's clean frequently. Clean your areas frequently, promote the hand washing to the students and staff, and then improved ventilation in those areas. Those are just 3 recommendations from the CDC on in-place dining. So.
Thank you.
Right.
But you can also consider cohorting as a possibility too.
So.
Thank you.
Thank you.
All right.
No, I don't. Thank you very much.
I do have one quick question about the face coverings. And, there's a difference between clinical settings and applied settings where people actually live, work, breathe, walk, talk. And I've been looking for any emerging studies about fidelity of mask wearing. In other words, I know that we did not have 100% compliance in our schools with not only wearing the face covering properly, but removing it properly, dealing with it properly, disposing of it properly, all of those things. Is there any research yet that you know of that's been conducted in applied settings that would give us some data like, okay, well, if 50% of the time it's below your nose and dirty, how is that really helping? Does it improve does it reduce our chances of transmission 10%, 20%, 1%? I would love to see some numbers like that.
I haven't specifically seen it, but it doesn't mean it's out there. I'd be happy to look at it. But I think that you bring up a very good point with regards to facial coverings is, when we really talk about an approved mask, what's an approved facial covering? And the appropriate wear, I know you would see people with it down below their nose, it turns into a chin strap, gaps on the side. So it's a great point, but I'm not so sure that, to that extent that we have that data available specifically for Florida, but I would be happy to look and see if there's anything I can find for you to research.
Thanks, I appreciate that, and I'll keep looking too, because my point is that as a school system, we want to target the behaviors that are most likely to be complied with at very high levels. So if that's the typical hand washing, which we all know is important, and we know it's a life skill to clean up after yourself, emphasizing the behaviors that have the highest rate of compliance. And I'm not sure that the face coverings were it.
I'm going to throw Preston under the bus, but I believe that they're I believe
you're next, sir.
I know he's been talking about some hand sanitizers and hand sanitizing that will be given to the schools and made available. So I think that there's even going to be more resources. Emergency management has done such a fantastic job over this last year for us And he's done everything through the schools, for the schools and for the Department of Health as well, to make sure that we can provide safe environments for our community. So I think that's another option you have. And speaking to your part about sanitation and cough etiquette and hand washing, I think that's just another thing that's being done through emergency management that will bolster protection in the schools.
Right, that's great to hear. And PPE is expensive.
Absolutely.
So we want to just make sure we're having the best return on the strategies that we're using, in my mind.
Absolutely.
Mark, I do have a couple of questions. Hospitalizations in Marion County. I know that number has gone up the last couple of weeks. You said, you kind of alluded to that.
Right, and we've seen, we used to get a specific report that we don't get any longer, but we're looking at trying to bring it back. But I did speak with one of our hospital systems, and they've seen their cases go up. When we stopped getting the report, we were down to about 20 cases on average a day in the hospital. And I know the one system that I spoke with, they were around 37 to 40, and they were all the way down to about 8 a day. So we have seen an increase, and we've seen it. And when I spoke to this hospital system, it is more of that age group we were talking about, in that 30 to 40 range.
Of those hospitalizations, have they had the shot or have they not been vaccinated?
You would have to speak specifically to the hospital systems on that. My understanding is the majority of people that are being hospitalized are unvaccinated, is what we're seeing. But I don't have those specific numbers, and so I would say you could reach out specifically to the hospital. That's something that we're working on, a reporting system to get more information, since the old numbers are not available.
That would be good information to have in our next weekly update with you.
There again, the good numbers that I continue to that we look at is when we realized at those peaks, and I'm getting old, so I may have already said this, but in those peaks we were seeing that 65 and up population, several hundred a day, or excuse me, several hundred a week, 65 and up population being impacted. Now it's been down below 50 for weeks, or for months, since we started the vaccination process, and we vaccinated almost 80% of our seniors. I think the CDC chart I was looking at this morning had us at about 79%. And that was a key point of looking at the school closures initially back in March, is because you had a situation where a group that could easily pass the virus up to individuals who were not, there was no vaccine. Now with the vaccine available, we've seen that protection in that 65 and up population, which the hospitalizations are going down in that group, as well as the number of cases. So I think that is a fantastic data to report from community data. So.
Since you're talking about vaccine, I'm going to make my shameless plug right now. So just for any parents that want to get their child vaccinated, we will be at the Paddock Mall on July 31st from 9 to 12. We will be having back to school vaccines as well as Pfizer vaccines for 12 and up. And then we will be at the health department on August 7th from 9 to 1, doing back to school vaccines as well as COVID vaccines.
Is there going to be a flyer or anything?
I think Craig did put something out in media already that we can absolutely get to Kevin.
Yeah.
For sure.
And you're doing daily vaccines?
We are doing daily vaccines, and if anybody would like an appointment at the Department of Health, they can call 352-644-2590 to make an appointment.
That's 352-644.
2590. Yeah, thank you.
As far as testing, where can they get testing?
They would have
Because
to.
I know the sites are not as available.
Like I said, we do the school testing. They can call that same number. That's our call number.
644-2590.
And they'll tell them where there are some available sites where they could get tested. We currently are in discussions with emergency management.
We're going to finalize
Finalizing today, we're going to bring back, since they're like the 1 day a week community testing that we did, we're going to bring that back for a period of time just to handle any individuals that want to be tested during this current spike. So we'll be bringing that back in August.
That's great. As part of our back to school initiative, I was wondering about the availability of like quadrants, because Marion County is so big, and just really communicating it out to the public. If you live in Marion Oaks, your closest spot is here for free testing. If you're in Fort McCoy, you know.
So we try to keep that information current at the health department, so they can call into that number, ask, where can I live in this area, where can I get tested? And they have a list of entities that are still providing a test.
Most people hop on their cell phones anyway and can just Google COVID testing free near me.
Right.
Yep.
Right.
Yeah.
Madam Chair, if I may, I know I said this before, but while they're both here, I can't thank Mark Lander and his team enough, and Preston Boland as well, for the work and the partnership this year. As a superintendent, our team has been, we've worked very closely together, and I don't think that we would have had the success we have in keeping schools open that we've had because of this partnership. So we've spent a lot of time together, and we will continue to as needed, and are going to continue to be flexible, but truly because we are not the health professionals or the emergency management professionals, can't thank them enough, and I want to thank them while they're here.
Absolutely, I thank you all. It's, like I said, that all the behind-the-scenes efforts that we've been putting in have made a difference.
And thank you for including us as a school board. I believe we've all really felt that that's been so productive and important for each of us to take our turn each week and participating, and then we're all in the loop and hearing the same information. So,
Absolutely. We look forward to continuing.
other than the virus, it's been great.
Other than the virus, it's great seeing you all. And it's nice seeing you all in person. So.
Thank you, Mark.
Thank you.
Thank you.
And I do want to add, if I may, while the team's coming back up, thank you. I do support what Mark Lander shared about staying home sick as the superintendent. I support that. If our children are not well and our employees are not well, we want them to stay home and get better. So I just feel like that's important to say.
Thank you.
Oh, I had, so I need to ask them, can you ask them to come back before they get out the building?
Oh, there he goes.
They'll probably hear my question as they're coming in. I do know last year that there was like a list of things or signs or symptoms that they saw that schools used to send kids home. Are we still using that same list of symptoms to recognize or designate someone that needs to go?
Yes, we have the symptoms that are COVID-like symptoms that are being followed. And
So nothing's changed with that list?
nothing has changed. There's been no additional guidance come out from what we switched to and what we had on our list.
And the same procedure as far as if the kid goes, the parents takes them to the doctor says this is something that they have all the time, they're still able to come back, no quarantine, what?
As long as that parent has a note from that physician stating as such.
That it's allergies or.
That's correct.
Yeah, basically the alternate diagnosis. If they have the alternate
Right.
diagnosis, then it would be whatever you have as in policy in place for your school board for sickness, whether it's a stomach illness or what, they would follow your standard school board policy.
And I apologize for not asking that, but I know going into this new school year, that needs to be put out there now for parents, because there were a lot of parents that had issues last year, especially if it kept happening over and over again. You know, some kids.
headache.
They had a headache. They had
The headache was a big one.
a headache, and they were getting sent home, so.
And we can share, we can get that.
I didn't know if she wanted, are you able to say that? I don't want to put you on the
No,
spot.
it's fine.
I didn't, I thought it might be
I should
helpful
know
to
these
hear.
after being
I don't
a year
wanna
and a half
put you
during
on the
COVID,
spot if
right?
not.
So some of the early signs and symptoms we see is nausea, vomiting, diarrhea, can be shortness of breath. If I miss any, remind me. No, it's fine. Shortness of breath, loss of taste and smell. Headache, yes, headache is a big one. I know I'm gonna miss some. Now that I'm sitting here on the spot. No, it's fine. No, it's
But I
fine.
think the big was, like you said, the loss of taste and smell, the headache, fever.
Yo, fever, yes.
And and the problem is a lot of these.
Chills.
Chills. A lot of them are very
Yes, thank you.
similar.
Difficulty breathing.
Yeah, shortness of breath.
Yep.
A lot of them are very similar to other, so that's why it's important getting that. If it is an alternate diagnosis, there may be a history within that
Right.
student or staff member, and we want their medical professional to evaluate that and determine whether or not they would need. And another thing that I know we mentioned about staying home when sick, and I didn't say this, and I apologize. If you've been tested, you've been tested, you felt bad, you went and got tested, you might feel better the next day. Don't come back until you get your test results.
Right.
That's the big thing.
Stay home while you have a pending test result.
You know, because, from experience, you can feel good one day, you can feel bad the next, and then feel good 2 or 3 days, but you're still positive, and that's the key. Wait till you get your test results that say you're negative before you return.
Right.
Thank you.
Thank you.
I apologize for that. That hit me as y'all were walking out the door. I was like, we need to make sure that the schools are on.
I told JC earlier when she stole my parking spot and I had to park farther.
It's a tough crowd in here.
Trying to help you out. Thank you all again.
Thank you, Mark.
Thank you. Oh, that's a roll off the list. Thank you.
Just to piggyback on that quickly, there was a lot of angst last year as educators and using their professional judgment when it comes to getting to know kids. You know, parents know their kids the best. I would say teachers are a close second in the day-to-day, and, you know, we do have kids that use things like stomach ache, headache, you know, they don't feel good, they want to go home. So that's something that we have to make sure that we're being sensible about and using our professional educator and local parentis judgment. And I'm thinking about kids with IEPs. If it's documented on their behavior intervention plan that they say they have a headache so that they can go home, you may want to just have a conversation about that. We need kids in school, but we need them healthy, we need them safe. This is a shared responsibility and a huge community effort. So I just want to put that out there because I know from visiting my schools last year, principals were agonizing about those kinds of judgment calls.
Right.
So, okay, thank you.
Yep.
All right.
So do I need to restate the question?
So your question, no. Communal spaces, right? So it would be school specific. There's a lot of factors that go into that. That's why, you know, we reiterated as much as possible. If we use those communal spaces, we would still continue social distancing, but it's as much as possible. It's school site specific, meaning the size of the cafeteria, the number of enrollment of students, their master schedule. Can they span out lunches in a longer time frame in their master schedule while not impacting instruction? Even down to the types of tables that they have. You know, long rectangular tables are much easier than the round tables. If we do use those communal spaces, what we can work with our principals on is definitely keeping the same cohort of students at those tables, so at least we can identify them in the event that there is a positive case.
And I thought about this because last year during this time, I went out to a school and we actually kind of measured in a classroom, and we actually measured in cafeterias, and that was with a small group of people coming back. And I do know in certain schools, cafeterias, you had kids that were all facing one direction. Also, it kind of took out half of the cafeteria. So it's going to get done. I do know that. But I just want you to make sure that you give those schools the proper guidance on it, because when we go out there and we're looking at this situation, if it looks like it's chaos, it doesn't show that we're doing the mitigating strategies that we're saying that we're doing.
Yes, sir. Understood.
That's a serious concern. And of course, we know we're going to have more kids back in school because they started coming back. I'm just not seeing this 3 feet. I'm not even seeing 3 feet. It's not possible. Am I right?
So it is very difficult. Some schools, like I said, it's that size. Some also have an outside area that they can spread, but they can spread out the students. But it is going to be very difficult to get to that.
Are we going to encourage the teachers to do some outside activities and things like that too? We keep talking about ventilations. We keep talking about ventilation. We haven't built the new school since last year, and if they didn't have proper ventilation last year, they still don't have proper ventilation. So we have to look at ways. Are we opening the doors? What are we doing?
We can definitely have that conversation, and that actually, I know one of the recommendations from the state music department is elementary schools, if they're singing, their recommendation is that they do sing outside. So we will definitely take that back and work with our teachers on that as well, and promote outdoor learning when possible, when the weather permits, and so forth.
Yes, there's been a lot of conversations around that. In fact, I wrote down ventilation in large letters, and that is very important. And picnic tables don't cost that much. And So to get our kids outside, knowing that our buildings are old, I mean, look at this, look where we are right now. We have no windows. I think we're probably breathing recycled air, you know.
And we probably have high school construction departments that could be building picnic tables if there was wood available. I mean, if that was something that we wanted to try to put
Right.
in our schools.
Right, so it is a new way of thinking, and again, thinking back to the Spanish flu, when things were getting so overwhelmed in hospitals, they started by necessity having to put patients outside. Well, they were the ones that recovered faster because they weren't continuously exposed to everything.
And that's a very good point, because last year when we did have masks, or face coverings, regardless of what we do this year, most of those students did have mask breaks where they went outside and if we don't recommend face coverings this year, those continued times outside may still be warranted for us to try to at least include in students' days to some degree, as best we can. I understand that secondary is probably not going to have the block schedule where you're going to be with the teacher for an extended period of time where they could take that extra 5 minutes. So there may be a little bit more of a challenge to work in that outside time, but perhaps specific classes or specific teachers or something might be able to work that in. I think that would be incredibly important, just as Ms. Thurl was recommending.
That could be a bit of a culture change too, because at least in the past it was like, why are her kids out of class? Why are they outside?
That just depends on the school and the teacher.
It does.
I can assure you, I could already envision elementary students underneath the awnings sitting on the side.
Those overhangs.
I was like, I don't even see a picnic table necessarily. There are ways to be creative that are free, and outside is free, you know, and there's blankets or there's towels or
sheets.
There's sheets. So I think teachers and principals are pretty creative and know their schools and their students, and I don't think as a board, I don't feel comfortable going in and telling a school what they should be doing. I think that's probably at their discretion, but that's just me.
Well, right, and it's the encouragement, you know, to continue thinking outside the box, and that in the end, what's more expensive and detrimental, you know? Kids being out on quarantine, classrooms having to be shut down. You know, if we do all of these, the details are always everything. You know, you can have this big grand idea. Yes, our big grand idea is to have school start on time, not close once, and have a great year. That's our big vision. But how we make that happen is the bones of it. And empowering, I 100% agree with you, Vice Chair King, empowering each school to do it in a way that makes sense for their environment and the way the building is laid out, the hallways, all of those things. And they did such a great job on that last year, and that's why we didn't have one school shut down. So they're up for it.
So what I'm hearing you say, communal spaces and cohorting, we can move forward, putting in as much of these mitigation strategies as possible, and a lot of guidance, right? School specific though. Okay.
I agree.
Okay. We got 2 more topics.
All right.
So
Right along.
the next one is the volunteers on campus, visitors on campus, events, orientation, end of the year events, athletics, fine arts. What is what's the guidance that you would like to give us for that?
Dr. Gullett, I'd love to hear you weigh in on this one.
Sure, absolutely. Thank you, Madam Chair. Members of the board, I think that our students need to be in classrooms, and I think that we have felt the void this past year of not having our critical volunteers in the class. It was a tough year for all of us, but I think if we put our students first and we continue to heed the guidance from our health experts and practice these mitigation strategies, I welcome the volunteers to come back. It's their choice to come back. You know, if face coverings continue to become optional, that's a choice they make. And, you know, we would certainly let our schools know and our parents and students. But I think it's important. I am deeply concerned about gaps that I see and that will continue and we haven't fully realized for our student learning. We have an incredibly dedicated group of teachers and leaders and non-instructional support staff, but I know everyone relies on help. We work on this together. It's a collaborative effort to lift up our students. So meeting their needs fully, I think we need everyone's help. So I support volunteers and visitors coming to help us with that work.
Board?
I completely concur with that. If we're looking for recommendations specifically from the board. I was with the principal yesterday who was talking about how important it's going to be when she sees a grandparent walk in. I need you. When she's talking, I need you. Like I'm going to need you this year, because they understand, our school-based administrators understand what they've seen this past year and the challenges that they've experienced, and how those volunteers are incredibly impactful to the success of the student learning. So I completely concur. Volunteers, I'm all in favor of.
Thank you.
I am, as long as we're transparent, for example, like reading pals, when students will be reading with an adult, I think parents should be aware that their student will be working side by side with another adult. I would like to see that. And then also, I guess this is a question for the attorney. If an adult volunteer comes into the school and then happens to get COVID that evening or the next day, as the school board, are we held harmless? Like, how does that work? Or should they sign something saying, if this happens, like, I just don't want people getting sick and then blaming the school board. So how's that look?
Well, that's a long discussion, but the short answer is that there are a number of protections against COVID liability, of which we've already initiated a number. Waivers are a possibility. They are. There's some debate over whether they're effective or not, but we certainly will look into making sure that we have any mitigation factors legally in place, just like we do for physical barriers and the virus itself. So yes, in general we would be, I believe, held harmless without any trouble.
Okay, that's what my questions were. And as long as the parents are aware and are comfortable, I wonder how that would look. Do you know yet, or?
Well, thank you, Board Member King. We actually had quite a bit of conversation around this. If the board supports that decision, then we would work on the notification. What it looks like, we currently have an opt-out plan and procedure right now, but we would look at making sure that the communication is there from the school, and so everyone is aware. So we're working through the logistics of that, depending on the decision of the board today. Absolutely. But we would make sure it was clear, and we'll communicate that.
Okay, thank you.
Absolutely.
It looks like we're heading somewhere. We kind of dance around a lot of stuff. If we're going to go to volunteers, then let's say if you're going to take the mask away, say you're going to take the mask away. Y'all know my concern is to kids' safety, staff safety, school safety, period. That is my concern, period. If volunteers are going to come, and we do need volunteers, we definitely need them in school. I would encourage them. We can't make them, but I would encourage them to be vaccinated. We just heard what the health department said. So I would encourage that those volunteers that are coming on our campuses, that are interacting with our staff and with our students, that if they are legitimately concerned about the kids, and they're legitimately concerned about us moving the grades and doing the right thing, that they would do the right thing as far as health-wise for these kids and our schools, and so that we could keep them open. And but we can't make anybody get vaccinated. I'm not saying that, and we can't make them show the card or anything like that. But I definitely want to, on the record, say that I would encourage all the volunteers that will be coming on campus to be vaccinated. So.
Thank you, Board Member Cummings. And well, we know that even in a typical year, schools harbor viruses, bacteria, volunteers are definitely putting themselves at a certain amount of risk, even in a typical year, and this is just heightened. So it is important to keep emphasizing that. And these are our schools, shared responsibility community. We rise and fall together. Okay, moving on to face coverings.
Events are okay as well, right? That is using our strategies. Okay, yes. So let's move on to face
Wait.
At the school discretion, though, because I know, like last year, schools look different for the end of the year parties. Will that be the school discretion, how they decide? Because maybe a school may want to hold an event a little different than others, or how's that? We're still okay. I was just going to make sure we're not.
I'll let Ms. Keinert actually pop in as well. But in my year here, every school, all of those events do look differently anyways. It depends on what works for that particular community and school. So I think our principals would definitely use their professional judgment in scheduling those events. So for example, our principals are planning in anticipation for orientation, Meet the Teacher, and many of them have already staggered that out. So in years past, they would have them all on the same day. Now they're stretching that time frame out to reduce the number of individuals on campus at a given time.
No, and I completely agree, and I'll go back to the comment that Vice Chair King, you said earlier. Our school-based administrators with their teachers and their teams were able to really work through their own school-based plans last year through this pandemic. And so they've learned what works for their school culture, what works for their students and their safety. And so, they would like to be able to be supported and continue in those efforts, knowing that Meet the Teacher Day looks a little different on every campus.
Vice Chair King, do you have specific questions about that or?
Well, I was just thinking, as every school is different, and I was just thinking, like, for example, I think one event may have been held inside, and one principal chose to do it on the basketball courts, and so there seemed to be some distension, So I just want to make it clear that the principal still has, if they decide that they may still want it to be outside for whatever reason, and it works best, I want them to not feel pressure from this board that it has to be inside because that's kind of where I'm just clearing that out a little bit because I think there's some apprehension depending on the school and parents and just everything. So I was just clearing that up a little bit.
So with these outside activities, are we also talking about sports as well? That was a part of it. So is sports going back to full occupancy football games? Am I hearing that? Are we going against something different than CDC recommendations?
So Mr. Phillips is here. I think he's out in the lobby. He'll be.
Come on, Jody.
But that is the intent. I hear his footsteps now, I think.
Just like that.
No. So when I spoke with I met with him and Ms. Crowder earlier this week. That is the plan, is to go back to full events. That's what's in progress right now, to answer your question. But he is here.
Yeah, I saw him.
And while we're waiting for that, back to the flexibility, absolutely. I mean, we support that. And if we learn nothing else, we learned a lot of flexibility this past year, and I think some of those might continue. Right? So,
We've
your point,
discovered
absolutely.
some best practices.
Absolutely.
Yes.
Absolutely.
And empowering each school because each school is different.
Absolutely.
Good morning.
Good morning. Good morning.
Hey, man. Good morning.
I briefly heard.
Your name.
The question was,
Yes, sir.
they're talking about opening things back up completely.
Yes,
And my question was, does that include all sporting events, complete capacity? What are we doing?
That's our ask, and that's what we had asked the superintendent as well. So yes, that is the wish of our 7 high schools at this time. And I will tell you, I didn't think this was going to happen. I will share, we were able to get feedback from 21 other school districts just yesterday. So that's what we're seeing. The only one that out of the 21 that was 50% consideration still was Seminole. Everyone else, Hillsborough, even Clay, Osceola, Collier, we got a lot of feedback, and they are all looking at full capacity, at least to start. And I know the superintendent feels this way as well as we do, that we would just ask the opportunity to do this, and realizing that certainly at her request or yours, that it could change at a moment's notice, and we may have to make other plans.
Again, my concern is safety. As long as we can do what we need to do to keep all kids, all staff safe, that's my biggest issue with this. We don't need to have a football team or a basketball team getting sick because we got too lax. I understand we need to move toward normalcy. I'm completely for that.
Yes,
but we just need to make sure that we don't say, oh, just throw all caution to the wind and act as if we're not in the midst still of a pandemic. So that's my concern.
Well, we are stressing that starting yesterday, we began, back to practice our back to school meetings and interaction, and we'll be meeting starting next week with the football coaches and then all the fall coaches. So it is certainly on the forefront that we will continue. I think I want to reiterate, they said about the spraying and using that in the locker rooms and in the gymnasiums and such. That was huge. And we even saw some other part, I think the term used was like a silver lining, in the sense it has helped us with MRSA.
Correct.
There's been a lot of stuff that it helped with, so continuing that is important. And so we're not turning a blind eye at all, not at all. It's got to stay on the forefront.
Thank you.
Yes, sir.
Thank you. Okay.
All right, I feel good, thank you.
Thanks, Jody.
Thank you,
All
Mr.
right.
Phillips. And so the final topic is just the future of the face covering policy for the coming school year.
Thank you. And before we discuss that, Attorney Powers, just wanted to make it clear to the community what we've been doing here. We enacted a face covering resolution, which is different than a policy.
Correct.
Would you please explain the difference and how that affects our needing to vote on it and all of that, just the procedural piece of it, because there is confusion in the community about that. A lot of folks in the community think we're going to be voting on this on Tuesday, discussing it today and voting on it on Tuesday.
Sure, I'll take a whack at that, and then just let me know if I've answered the question
Okay.
to what you're looking for there. We, rather than enacting a policy under school board policy guidelines, we enacted a resolution. Resolutions may expire after a period of time. Typically, it's within 90 days. But those resolutions can then be renewed, or they can be extended, or they can have sunset provisions. And under a resolution, our resolution can indicate that we wish to take a particular action, and it states the whereas reasons for why we want to take that action. Then, after a period of time, if we choose to extend a resolution, we may extend the resolution, or we may allow it to sunset naturally and essentially die. Now, if a policy were enacted, a policy is a little bit of a different matter. A policy is something that stands until the policy is changed, altered, revoked by the school board and by a vote. In that effect, a policy is something that that has to go through a rulemaking process each time we wish to modify it, and it makes it a little more. It can be a blunt tool to work with from a perspective of trying to make sure that we have a situation which operates on the fly, something which maybe needs a little more attention to timeliness, or speediness. As you all know, we have to abide by the Florida Sunshine Law, and part of that is that we have to advertise our meetings. We have to advertise and give opportunity for the public input or comment on anything that we wish to take up as an agenda item. And so we do the same with resolutions as well. However, once a policy is in place, policies typically have to go through a rulemaking authority, which is a longer period of time for us to be able to alter them in one direction or another. So that's why it can be a bit of a blunt tool. Now, as to I don't know if that quite answers the question you're getting at there, but as to our resolution, we have had, with our mask resolution, we had that in place in order to allow us to have a policy which kept our schools open during the time period that it was required that we do so. We had to show specific efforts that we were taking for mitigation. Otherwise, if we didn't do that, we wouldn't be allowed to stay open. So in doing so, by addressing it via a resolution, it gave us the ability to set a sunset provision and allow us to choose to renew or not to renew our resolution as needed. But it is not something that we'll be taking up as a specific vote on Tuesday at a meeting. It's a different process. Now, some districts have chosen to enact policies, and already they found out very, very quickly when they began to enact said policies instead of resolutions, that they would have a policy in place, and as we all know from where we were back in March of 2020, you know, even with national news, masks work, masks don't work. Hand washing is best to do. Don't worry so much about wearing a mask. A mask can even be dangerous. All these things back and forth. So when you try to enact a policy that takes into account all of those things, then every single time that you want to amend your policy, you have to go through another, it could be 45 days in order to make that work. And it's not very efficient. It doesn't allow us to make changes that are needed on the fly, and it certainly doesn't allow us to efficiently administer the things that we need in order to meet the requirements that we need for our schools to stay open.
Thank you, Attorney Powers. I think that was important clarification for the community. My hat is off to you and Dr. Gullett and the rest of the leadership team for saying from the beginning that this was an evolving situation and we needed to stay flexible, fluid, nimble, and do what was best for our kids, our families, and our communities, and bring them into the conversation. And that has, I think, stood us in good stead. We've had a lot of conversations with people in the community. We hear from the community. I think they really believe now that we want to hear from them, and we need them involved to make our school system great. So thank you very much for taking the time.
Thank you.
To share that with us. Okay. Dr. Gullett, was there anything else that you wanted to put in on that? Okay. All right. Well, thoughts from the board.
We didn't get a recommendation from them.
What? What did you say?
We didn't get a recommendation from them, what they were. I want to hear what they want.
Okay, right.
We're going to put it back on y'all. That's our job.
No, that's why we make the big bucks, sir.
Let's hear.
Well, what about Dr. Gullett? Because she's our leader.
I want to hear what they're thinking is.
Yep, we want to hear everybody.
Thank you, Madam Chair, members of the board. I support face coverings being optional. We've done that this summer. I think we've done that fairly successfully. We've been working closely, as you know, with the Department of Health at looking at those, the impact, the number of students we've had, the employees that have been working this summer. And I think we've seen that it's working. And we will continue to be fluid and flexible. We will continue to work closely with the Department of Health. And if something changes, which it could, then we would adjust. But I think that we're seeing that this is workable. And I respect people's opinion to do what they need to do. Since we do not mandate vaccinations and we don't ask those questions, people need to feel comfortable doing what they're doing. That has also worked this summer. We've talked about that as a team. Students I've seen, the adults, some wear them, some don't, and that has worked. So I support face coverings being optional.
Thank you, Dr. Gullett. All right, ladies.
So, yes. I think if they're made optional, I think that our teachers can use them in what works for them in their classroom, right? So there will be opportunities during the day where the students can be spread out in 6 feet, right? In some cases, then they can take those masks off, right, if it's optional. But then when they're in smaller group settings, like if they're doing some small group instruction, if they can keep them 3 feet, that might be the opportunity to put them back on again, but it would be optional for those teachers. So having it optional gives a lot more flexibility to the teacher in creating his or her instructional lessons for the day. I also think about when we're learning especially foundational skills in K2, even pre-K, right? When we're learning about sounds, and I think about speech therapists as well, it's important to see the formation of your lips and your tongue, right? And you can hear the sounds better where with a mask they can be muffled, and so that's just a consideration. So if it's optional, we can take them on and off. That's appropriate for that classroom.
So then is your recommendation that all students have a mask in their backpacks? Or, I mean, based off of what you just said, it kind of sounds like that you're still encouraging us to at least have students have a mask present with their...
I think it's optional for the family. So I would think a parent would have the conversation with their child, right? And say, okay, if you're going to be in a small group, I want you to put this on. But if you're farther away, you could take it off. I think it's a parental decision for sure. But again, if there's a teacher that feels more comfortable, this gives her that option as well. if she or he wants to wear it.
Certain.
I was thinking students for a second.
Yes, yes.
So I'm just going to think outside the box for a few minutes. I don't want to be able to walk into a classroom and I see one side of the classroom with kids in masks and another side of the classroom with kids not masked. Is that a possibility? Very much so. Because the teacher may have a preference, correct? Are we thinking? Just think what I just said now. If there's a teacher that wants to be masked up and feels that her classroom or his classroom needs to be masked, is there a potential for that teacher to segregate that class based on mask?
Well, it's public education, so there's a chance for anything.
Well, I think,
I just want us to think. I'm not against it. I'm not against it, but I just see a whole lot of open doors with this situation. There's a whole lot, and if we're going to do it, we need to have some conversations with our staff about that type of thing. We need to have conversations with parents about kids not COVID shaming, mask shaming kids, or mask shaming staff, or vice versa. Those are real conversations that we have to have when we were having this discussion. Getting on the bus. What if the kid wants to sit beside you that doesn't have a mask on, or one that has a mask? I'm not against. Let me state this. I'm not against optional masks. I'm not, but I just want us to have it thought through and have had those real discussions.
Right. And I think the beauty of having full summer school learning opportunities, obviously those were optional, right, for our students and the teachers and staff that worked that. But we did have a very large number. We had almost 7,000, over 7,000 at certain points of students taking advantage of that summer learning opportunity. And we had the optional mask options there. And when we walked in the campuses, when several of you were walking our campuses with us, Dr. Gullett, what we saw many students without face coverings, but we saw students with face coverings. Where we thought we might have some of those issues where, there might have been pressure from students to wear them or not wear them. We really didn't hear that, and we didn't hear that from our principals that were there on site. We did not hear that from those classroom teachers that worked. Now, I understand that's a smaller percentage of our actual teachers that are coming back in 2 weeks, but that was the beauty of having the summer learning opportunity opened wide to every school campus, because we were able to kind of see a smaller glimpse of what this could look like for August. And I'm very pleased that our campuses were able to, we didn't see certain students with face coverings in one area of the room, or students without face coverings.
But that's a much smaller group too.
It is, but I think that's certainly the data that we have, because that is the data that we have, right, that we've been able to see so far this summer, and we did not run into those issues. I think, we've relied heavily on our school-based personnel and staff with our guidance, but to really, they know their school culture, they know their teachers, they really worked hard with their staff and their teachers last year, when we had teachers, in many cases, that were very fearful of coming into work with our students. And I feel like the principals and the APs really did a great job of making sure that they, throughout this entire year and a half process of the pandemic, getting those teachers, hearing their voices and listening to their concerns. And that has been, I think, part of our success in our district, is that our administrators were able to continuously go back to their teams on their campuses and really work through some of these problem-solving issues with them.
Right. Thank you, Ms. Kiner. Those are great points. And I know from my school visits that I walked into many secondary classrooms with 22 kids or more, just because of the nature of the class and the availability of the instructor. And some had masks on and some didn't. I don't know about the rest of the board. I'm sure you'll share. I was very happy that I did not receive one phone call from any parent saying that their child had been mask shamed one way or another. I firmly believe that schools are a reflection of society. And you go into Publix, some people have masks on, some people don't. It's kind of like what we've gotten used to seeing. And this is one issue that we are never going to get. Well, you never get 100% approval on anything, but we are certainly never going to get anything close to a consensus on this one. But I keep saying, shared schools, shared responsibility. You know, gone need to be the days of I have to get to work, and I know this from raising our kids. You know, don't be tempted to give them Tylenol and send them to school with sick eyes, because you are jeopardizing the education of each and every student. And if we want to be a successful community, that has to be the priority. I hope everyone have fun on their vacations this summer, and I hope you don't take another one or have a family reunion the first month of school.
Where did that come from?
My heart. This is important. This is important. If we're going to talk about individual responsibility and individual freedom and being able to move forward as a community together, then it's not just about us and them. It's about us. So, you know, if we're going to take this on and have less regulation and more trust, which I'm hearing has worked well, and we've done a great job so far, we just have to keep that in mind, every single person.
Yes, I think if we're going to take it on, that we have to be accountable.
Right.
And everybody has to be accountable. Everybody.
And frankly, to Board Member Cummings' point, I'm kind of thinking about this, and he was referencing mask shaming, vice versa, how that might look. And frankly, what I would love to see, this goes back to conversations we've had earlier in the year, rather than mirroring society right now, because we have seen that in our community and elsewhere, mask shaming on both sides. Rather than mirroring society, I would love for us to be teaching in our classrooms civility and how to have character and integrity and actually be the leaders in this conversation, rather than what society is looking like right now. So I believe this goes, again, back to some of those things we've talked about. And if we are showing and leading that conversation, then our students can actually be the leaders in our community to change that conversation and change that dialogue and show what civility looks like when it comes to being with people who have a different opinion than you do.
Right. This is a golden opportunity.
It is.
It is.
It is.
I think we're up for it.
Yeah, well, I've been out and about in malls and everywhere, and it's not even just a county thing. It's state, it's, you know, national, it's world. I almost think, I mean, I'm not in the classroom to tell you. I almost wonder if we're worried more about that than what's happening with our students. Because when I'm out and about, I see some families with them on and some not. 3 weeks ago, I was out, probably 80% didn't have them on, and, you know, like down in Tampa malls. I was there last weekend, and I'm seeing an increase. I think families are being responsible for their own choices and children, and I'm in support of that. So I'm for optional.
Okay. Well, it looks like we have consensus on our face covering resolution.
Thank you.
But we are monitoring it, right, though, because if we
yeah.
have, like, that's the one thing I would like to discuss a little bit. I mean, if we have a huge outbreak, I mean, I think what we have studied is usually the children aren't usually affected as much as the adults. Should that change, I know there is a new variant, say our numbers increase and spike up, we are going to revisit and be responsible.
Yes, Vice Chair King, absolutely. So for what you heard earlier from Mark Lander and his team, as well as ours, we will continue to monitor. We have weekly calls. Those we've already agreed, those will continue. We talk in between as well through the school teams and district to the Department of Health, but we will have those continue. And we all agreed, and we've said this the last few weeks, if anything needs to change, we'll change it. We'll bring it back and we'll adjust. That has worked for us. We continue to have those conversations and we'll continue to monitor. They're doing the direct contact tracing. They're the ones that have the data, and that has worked so far, and it's worked well this summer, so we'll continue to do that and adjust if necessary. Absolutely. Absolutely.
Because we're making this decision when the number is high.
Yes.
Higher than it has been. And that's but
the children, I don't think, are in those
but
numbers.
when we made those decisions, we made that decision based on overall positivity rate.
Right.
We didn't separate it between age or anything. It was just the overall positivity rate. So the overall positivity rate is still high. It's higher than it was a couple of weeks ago. So I just want us to make sure as we continue to monitor that we are conscious of it, because I'll be the first one to bring it back and say, hey, we need to look at this thing. And then I'm also having concern about, and Ms. Rohr's in the back of the room, with these kids getting on the buses as well, because that's another factor, especially when we have a shortage of drivers, and we have that's a concern when we don't have enough people to get folk to school, and it's because they're sick and they're out. So is that policy going to be the same, that same procedure for masks on the bus?
The recommendation as it stands, Board Member Cummings, is
Optional all over.
is voluntary everywhere.
Okay.
Right. Now, if we find that through our weekly contacts and our calls with the Department of Health, there are some pockets, just like we did last year when we started this, when we found that there was a school in a certain grade level and we made an adjustment. If we find there are patterns with transportation alone, then we'll address that. And we can isolate and address those as they come. We don't know what that's going to look like, but we stand ready to adjust as needed, absolutely, on any part of this. Absolutely.
I just keep hearing in my mind, pump on, pump off, like a pump in, pump out, a hand sanitizer, pumping in, pumping out. I mean, that's what they were doing in elementary school. As soon as the kids were walking in, make sure you have your hand sanitizer on your way in, on your way out. Same thing potentially on buses, and I keep having that in my mind.
Yes, Board Member Campbell. So I'm looking at Ms. Roy, and she's nodding her head because I said, we're doing that. And she's like, yes. So do you want to add anything, Ms. Roy? I hate to call you up, but I know we're doing that, and she's confirming, yes, that we are.
Good morning, and thank you for addressing the Transportation Department as well. And that's correct. We will continue all the procedures that's been in place. The Omni Shield on the buses, the drivers will be provided the solution for cleaning in between the runs. They will continue to log on the special made pre-trip form that we have throughout the day, showing that they've taken precaution in cleaning the buses. We will continue to report to DOH any positivities that we receive from our employees, and they will do that contact tracing for us. We did continue that through the summer as well, and we will follow the recommendation that you guys come up. So I do appreciate, Mr. Cummings, that you brought us up, because I was waiting to hear that. We're all on the same page, and I like that consistency across the district.
Okay, so it sounds like you're comfortable with face covering optional for the start of school.
That's correct, and we will continue to monitor. We'll keep track of everything, and if we see a significant increase, we'll definitely notify.
Thank you.
Because you are close to our hearts, and I'm thinking about last year with so many absences and on the fly, drivers having to pick up routes, pick up kids. It got chaotic. I know sometimes it was difficult to adhere to the seating charts, or to even, if you're picking up unfamiliar kids, to even remember where they sat, because in the end, you're trying to get kids home. And I'm sure there's a lot more paperwork, because you don't get money from the government without a lot of paperwork. So anything that you need to streamline your processes and support, so that when contact tracing becomes necessary, that it is as least burdensome as possible, and get the job done accurately, please,
Thank you.
Thank you. Okay.
And just to follow up on a question that Board Member King asked earlier regarding liability and COVID, I would strongly encourage anyone that wants to look up SB 72 it was signed into law by Governor DeSantis back at the end of March in this legislative session, and that actually speaks to liability immunity for business entities, schools, government institutions, churches, so that generally there are quite strong protections, whereas waivers in general always have provided weak protections. This provides quite strong protections, and in fact, it essentially creates barriers that are quite high for someone to engage in frivolous lawsuits, or there would have to be showings of rather extreme, gross negligence on the behalf of someone that actions that would go far and beyond the pale of what we discuss here. Obviously, we're taking good mitigation efforts, and I think that I'm comfortable with where we are, and especially given that that legislation being signed into law. So.
That answers our question there.
Right, but the same, everyone should know, I think, the same applies to business institutions. It applies, it keeps people from going a little bit legally crazy, as they also are having to deal with all of the difficulties that we're facing regarding the COVID crisis in general.
Thank you.
Great, thank you. And this may be almost the last point of clarification as we're winding up our COVID-19 update. School buses are not public transportation. Is it accurate that Suntran is requiring face coverings still? I haven't ridden a Suntran lately. Does anyone know?
I don't know.
Anyone know? Okay. But I'm thinking about airplanes, because right now, you still have to wear a face covering on an airplane. And I think on public transportation, I think they're required. But school buses are different. So we get to make our own guidelines. Just want to make sure that and I'm sure that you would have known that well ahead of today.
Correct.
But, okay. All right. Anyone else? For the good of the cause.
All right. Thank you
Thank
very
you
much.
very
All right. Thank you.
Y'all like the hot seat.
And thanks again to everybody. Thanks to all of our employees. Thanks to the community. We really are together on this. Is there any public comment? Ms. Sullivan, come on down.
Oh, she has, or pages.
Oh, papers. Oh, I'm so sorry.
Oh, sorry. Tracy Okus is first.
I just want to thank you all for.
If you could just state your name.
Oh, sorry. I had it written down. I didn't do it. Tracy Okus. My name is, my address is 846 Southeast 14th Avenue, Ocala, Florida, 34471. And I just want to thank you all for adopting this resolution, this common sense resolution. And I think I just hear a lot of common sense in the conversation today, and I'm really impressed. And I'm really thankful for my grandkids and all the kids this year. They can feel a little more normal, and I think maybe a lot more normal. So thank you very, very much. Appreciate it. Thank you.
Thank you.
Next is Miss Lucy Sullivan. Okay.
Take two.
Lucy Sullivan, 811 Southeast 50th Terrace, Ocala. Again, thank you. I liked a lot of what you all talked about today, especially going optional with the masks. I want the kids to be able to breathe, number one, and number two, feel normal again. But I want to make just a couple of comments. First, the mask situation, being worried that there's going to be mask shaming or anything. I agree with Ms. Campbell that it's a great opportunity to learn respect for different views, civility, and getting along with different views. So that's my first comment on the masks. Second, regarding mitigating the spread of any virus, the flu or anything like that, one component was left out that wasn't mentioned. Kids should not be returned to school unless they've been 24 hours fever-free. That's a very important component. Fevers tend to come and go, and they wake up without a fever, and then at 3 o'clock in the afternoon it spikes, and it might be just a mild fever, but they're still contagious, so that has to be mentioned. And also, I don't know how you guys would do it, but I think parents need to learn that the fever is actually a good thing. It's building up your immune system, how to allow a fever to do its work and not try to mitigate it so quickly. It lets the body build up its immune system. So I'm just throwing that out. Now, regarding the vaccines, and again, just like Mr. Cummins, I am concerned for the safety of all kids, and I don't want to throw caution out with to the wind. These are still experimental. These vaccines are have not gone through the rigorous testing program. Now, they are coming with lots of complications and even deaths. And if any of you knows what the VAERS website is, which is by the CDC, it's a self-reporting website regarding any deaths or complications from vaccines. Since the vaccines came out, deaths and complications have gone through the roof. And you can look this up by yourselves. Deaths in the thousands and medical complications by the thousands as well. England, their health minister 2 days ago reported that 60% of those hospitalized, 60% hospitalized with COVID, 60% were actually vaccinated. Now, regarding young children, 12 and up, getting vaccinated, there's complications, especially with young men getting enlarged hearts from the vaccines and dying from heart attacks at a young age. If you're going to recommend vaccines for 12 and up, I would hope that a measure of responsibility would include a warning that these things are possible. When you watch a TV commercial for a drug, they always tell you at the very end, this could happen, this could happen, this could happen. You want the client to make an informed decision. So I'm asking you to, I know everybody seems happy about and giddy about the vaccine, but it does come with a sense of maybe it's a little dangerous for some people. So I would hope that you would share that with the people. And also, let's just continue to work hard on keeping our children's minds smart and healthy. Reading, writing, arithmetic, and let's work on that. Thank you.
Thank you.
Mr. Brian Carth.
Good afternoon. My name is Brian Carth. I live at 4091 Southeast 26th Court Road, Ocala, Florida 34480. I have 4 kids in the Marion County school system, and we range from age 4 up to 13. I do want to thank all of you for the work that you have been doing and the resolution that you did come to today. That's what I'm here to talk about is masks. I believe that this should be put on the parents and not on the school board. This is our decision. I don't want you making it for me. This I feel very strongly about. I work for Marion County Fire Rescue. I deal with people with COVID, with all sorts of diseases on a daily basis, and this is not your decision. This is my decision. I will decide what is right for my children, and you will not. That's simply what this has to come down to. You guys have rules and regulations that you follow for whatever you do with your jobs that you've been voted into to take, but you don't have the right to tell me what I can and cannot do with my children. That's not the America we live in. It's not the America I want to raise my children in. So that is all I have to say. Thank you.
Thank you. That's it? Okay. All right, thank you very much, everybody. Let's go ahead in the interest of folks that are waiting to present and go right into the school planning update, 5-year work plan draft. Pardon? Oh, okay. Maybe we will take a quick 5-minute break. What are
It was freezing.
We'll go ahead and resume our work session at 11:02 a.m. Moving on to school planning update, 5-year work plan draft. I do need to preface this by saying that we will have to take a break just before 11:30 to do our special school board meeting to receive our tentative budget. So we'll just make that happen when it needs to happen. Thank you.
Well, good morning, all. Once again, appreciate the opportunity to speak to you. We actually have 3 different things to update the board on. Obviously, the big piece is the 5-year district facilities work program, also the old Reddick School, and we have a hurricane sheltering update for you. If it's okay with the board, I'd like to see if we could do that first. We have some folks in the audience that are outside the school district and have other obligations as well. So if that's okay, I'm going to turn it over to Ms. Barbara Dobbins, Executive Director.
Great. So we'll move forward with our hurricane update.
Thank you very much. Before we do, I want to answer the question since we are on air, since we are involving the cafeteria, we will have the Omni Shield apply to every cafeteria.
Thank you.
So I wanted to get that out publicly. So as I put on the emergency management, I'm going to ask Mr. Preston Bolin to come forward and join us in partnership. So as we know, Mr. Bolin is our Director of Emergency Management with the Sheriff's Department and is responsible for all of Marion County. So we have been in conversations in the past with the Florida DIM grant that we obtained just over $2.7 million to retrofit several of our schools. So Westport High School will be completed by the end of this November, and Saddlewood's retrofit will be completed by the end of this September. When you take the rising cost and so forth with materials and labor, after we complete Westport and Saddlewood and the cost of the design, we have roughly of that $2.7 million, we have only $716,000 left to spend. Now this $716 and some change does not include any change order coming from Westport and Saddlewood. So if we don't spend that entire amount, we will get some money back. So we had to refocus what we wanted to do moving forward. So I reached out to Preston, and on this past Tuesday, we did a walkthrough of South Ocala. South Ocala was one of the schools on our retrofit plan. When we walked South Ocala and we looked at the cafeteria, building 3, building 4, 5, and 6, our original plan included retrofitting the cafeteria, building 3, building 5, and 6, not 4. When we looked at the money, when we looked at the buildings and their locations and their proximity to things like the cafeteria and so forth, we decided that it was not in our best interest to, at this point, move forward with building 5 and 6. So with the removal of building 5 and 6 from our retrofit plan, that will eliminate a cost of around $100,000. So with all that said and done, we are short approximately $51,000. So I reached out to Ms. Teresa Boston Ellis, our CFO, and asked if we as a district could afford the budgeting of $51,000 so we can move forward with including the South Ocala on the retrofit plan. Her answer was yes, we would take that from general fund and our capital funds, but it was something that she felt like, and she is in the audience, that we could do as a district. So if we move forward, this is on the board agenda for July 27th, and you will see the South Ocala cost at $867,000 and some change. That does not include the $100,000 less that we're going to spend not doing 5 and 6. But we are, again, I want to make it very clear that we will potentially have a $51,000 district cost. That does not include, I know there's a lot of math in this, that does not include whatever change order comes in from Westport and Saddlewood. So it could be that we get $30,000 back and our true district cost is then around $21,000. So those are the unknowns, but we wanted to make it clear that we do not have any more grant funds to move forward with our other projects, and working with Preston, the decision was made to move forward with the South Ocala and go ahead and complete building 3 and the cafeteria completely with the retrofit. So with that, I'll open it up for Preston's comments and any questions.
So one of the things that we looked at, with these projects is with the amount of money that we had is where that shelter would benefit the county as a whole and how we can get more numbers and taking into those calculations as well as we have to look at the schools of what years they were built and what the wind ratings are for each of the schools. And as we know, we've got a lot of schools in Marion County, but they were built so many years ago before storm ratings, were at the construction, for wind loads, at those schools. So, and again, that's the reason, one of the reasons why we're at such a deficit, for our population for Marion County is, with the schools. And so we thought that was going to be to get us the biggest bang for our buck and to be able to get us, I think it was right around 1,200 more shelter spaces.
1,114.
So, I think that would be very beneficial, if that's the route that we can go.
Great. Board?
I would say, I think that you're right on track. I mean, when I start thinking of where our shelters are located right now, we have done a pretty good job in my mind of at least going closer out in our four corners, but right in the middle of town, where South Ocala has been a spot that we do need better access to shelter right there. And so I think that's a wonderful plan.
And the recommendations from the state, when we talked with Pam up in Tallahassee that runs the shelter program, is the recommendation came back for Bellevue High School and Bellevue Middle School. The gyms were not, recommended because of the age and the amount, and for what we would pick up for that kind of money, it was just not real beneficial. And understanding with Saddlewood, we did have shutters there, but they were inoperable. We realized that those were replacements, so we really didn't pick up anything, but we didn't want to lose any of those numbers as well.
Well, and even South Ocala is only about 15 minutes away from Bellevue High School and Middle School. So, I mean, we're not talking 45 minutes away one way or the other. I mean, it's...
But there still will be utilized,
absolutely,
for shelters. It's just we didn't pick up those additional numbers in that area.
Also, South Ocala is near the hospital district, and we know that utility-wise, they're the first to come back online. So that was...
So those are a lot of the things that we looked at is for the rural areas, we're trying to get to those locations as well. So there was a lot that was taken into consideration in, making that decision. So plus too is working with Barbara and Robert is, some of the antennas, the old antennas that, that were obsolete and are not structurally, is the cost for you guys taking those down, is working with them to be able to where we can relocate those, is so the cost to the school district, if I can work with some of our ham operators and some of our other communications, to be able to utilize them in other aspects is, we might be able to save you guys some money and taking those down for you as well.
Great.
So, for the record, Preston, Ms. Dobbins, Mr. Knight, there's going to be 2 buildings that we're not going to retrofit at South Ocala.
So there's actually going to, yes, Building 5 and Building 6 will not be retrofitted at South Ocala.
Okay.
Due to their distance, due to their structure, they're the older portion and not the new part of South Ocala.
Right. And then there's going to be a $51,000 cost.
Yes.
That we're short.
Could potential
short. But everything's good with Ms. Boston Ellis. And there's a possibility that we could possibly recoup some of this.
Yes.
Okay. I'm fine with that. Thank you.
Vice Chair King?
No, thank you. I appreciate the update and stuff like that. And Preston, I again want to thank you. I think you're kind of behind the scenes. I'm not sure our county truly recognizes the person that is truly behind if there is a hurricane, COVID, whatever it may be. Preston is the person that is behind the scenes and very detail oriented and making sure that things are, to the best of his ability is pre-planned. He's not working on an emergency, it's taken care of. For example, this last storm, it wasn't a big one, but there wasn't no one was uptight, there wasn't any scrambling or anything like that. It was planned and organized, so thank you.
I do want to just start off for the next time Mark and I are here, I'd like to arm wrestle him for who goes first.
Okay.
No, but what I did want to, I was going to bring that up. I just want to be able to thank, everybody from the school board, from the district, is with this last storm with Hurricane Elsa, it was another one of those storms like Hurricane Dorian. We didn't know where it was going. It was a storm, it was a hurricane, it was a storm. It went left, it went right, and trying to make the right decisions. And again, for the short notice that we had, is having Dr. Gullett leading, the school district, and Ms. Thrower, coming down, and we're making decisions together. So like I said before 100 times, is we were a team. Emergency management, I need every one of you. I need every one of my volunteers. I need, my community partners. And again, we've got such a strong bond that makes things easy to be able to make decisions. And ultimately, just like you're making decisions for our students in Marion County, we're making these decisions for our residents in Marion County. And I'm always going to err on the side of caution. And again, not knowing where that storm, within 24 hours, we were able to activate and had everything in place, and everybody knew their jobs and positions, and it was very smooth. And I thank, your team and everybody involved to be able to, make that happen.
I thank y'all too, because those early conversations really make a difference. We were talking about this storm. I think we were on the phone Saturday. We were on that call. So, and the storm wasn't coming to Tuesday. So early conversations really make a huge difference. So thanks. Y'all keep doing that. Keep putting us at the forefront.
Yeah. Yeah.
It makes a big difference.
And for a $51,000 difference number, potentially, I don't see how we can afford not to do it. It's that important. And of course, we love deductive change orders. And maybe that will lower the cost even more. So I'm all for it. Thank you for everything.
So one other thing, just, again, is Robert and Barbara working on is for the North Marion cafeteria, is looking at what the cost, the end result would be to be able to harden that. We did some pre-planning ahead, looking for that for a future project. Is because I'm consistently always looking under different grant processes. And one of the ones that, we can also, because I will tell you from the state, the money that we got, this $2.7 million, is pretty much exhausted. I don't foresee it coming back anytime soon, because a lot of, like, the cybersecurity, a lot of that money now is being directed to other areas. So it may be, like the local mitigation strategy would be a project that we can put in for, once we kind of have an idea what the cost is. It's not a fast process. It could be 2 years, 3 years, but looking for other, if we get that on the mitigation strategy, rankings, if we find other grants, then as long as that is on there, and they, Tallahassee sees that, FEMA sees that as a need for Marion County, is a lot of these grants, is like a 25-75 split. So, and then we can try to find other means of revenue to be able to, depending on what the cost is. But we have to have it on that listing, as a county project, to be able to apply for other, apps or grants and stuff like that as well.
So, Preston, I'm just thinking, with North Marion, because we're planning potentially for there to be some shelter, that'd be a shelter site as well, correct?
Yes, sir, because that's where one of our needs. So as a whole for Marion County, we do have a deficit, especially now with the new census coming out. It wasn't a big deficit.
Yeah.
But, one of the things that, we have to look forward going, and I had this conversation, I met with the College of Central Florida beginning of the week, is understanding going forward in Marion County is because a lot of our shelters that we have now that are current, were built, to a lower wind construction. So going forward, storm's getting stronger, and, we got a plan as a county, going in that direction as a government. And so North Marion County, we just have North Marion Middle School. The cafeteria is the only thing that's hardened up there, and I think it's 200, 250 is what our capacity is there. And then the next closest for the north end would be Fort McCoy. So.
Oh boy.
Sir?
I said, oh boy, that's
Yeah, that's
So-
a long way.
Yeah.
So, in looking at that population, that's up there, mobile homes and,
Right.
older homes and stuff like that, to where, that was when we were building it, there's a need up there.
So while we're building this cafeteria, I'm sorry.
No, we're having the same question. Go ahead.
So while we're building this cafeteria, can't we build it where we don't have to retrofit anything later? We can just, we're building things into it right now. So is that the process that how we're going about this?
So unfortunately, at this time in building, so the building itself is 140 mile an hour wind speed, correct? It is the missile impact windows, so the windows and the doors of the cafeteria that aren't up to the code that they need to be. So that's what would need to be retrofitted. So the framing of those windows is already in. So if we change out the window, we now have to remove what we've already done. So part of what's being priced, and we don't want to change the aesthetics as well, so what Robert is pricing out, and we should have that pricing by next week, is removable shuttering. So if you think about what we have at the sheriff's department, where you go out
Right.
and you put up shutters and then you remove them after the storm. So that is what we're looking to do versus ripping out windows and door framings and putting something in new.
And that's, a lot of districts, and again, because there is a cost to it, I mean, that's something we have to take in consideration as well. But, when you're looking at designing a building, when we were talking about like legacy, in the cafeteria, you got that really, all that nice glass, but, for the aesthetics, but then you come back and you're putting grates over it or mesh, to be able, it takes away from kind of that aesthetic. So a lot of schools are, when they're building new schools, are taking consideration not only the hurricane impact of it, but also for active shooter, putting those glasses. And again, it's a lot more, but at least you're still keeping the aesthetics. You're still, protecting from hurricanes and also that threat of, active shooter, type things as well. So it's just something to think about, when you're going into the process of building new buildings and
The
schools.
next building we're gonna build, we gotta look at that. So we kind of missed it on this one.
Yeah, and Osceola cafeteria would be the same thing. I mean, right, again, I was just mentioning right in the heart of town.
Right.
That's another cafeteria that we could have potentially thought ahead on. That's a brand new structure that.
We did, and we talked about that, and the reason why the letter of exemption was because when it comes to sheltering, the numbers, for the parking, lot, the numbers just did not meet for the cost to the district. So, and again, as emergency management directors, not only, looking at those aspects of sheltering and stuff like that, but, being physically, financially
Fiscally responsible, yeah.
responsible.
Yeah, there's a lot to
I'm
it.
a taxpayer too, so.
No, sure, of course, and fiscally responsible, I'm 100% in favor of, but ultimately, if we're talking retrofitting at some point, then pay for it now or pay for it later. It's kind of the,
And
right, you're gonna pay for it one way or the other.
And unfortunately, is, the question was asked to me is also is if we do have, like some of that extra money, is could we have used that money to go ahead and harden, while we're still in the building process. That grant money will not allow us for new construction. So it's crazy, you can build it, put a brand new window in there, get your CO tomorrow, and then rip it out the next day, and you could use retrofit money. But that's just.
It's just government.
Yes.
Thank you.
All right. Thank you. And we probably do need to look at taking either a recess or adjourning, whatever is the legally.
We would do an adjournment.
We will do an adjournment so that we can move into our special school board meeting because it is advertised to begin at 11:30. So, and you need at least 5 minutes to set up, right?
Would we not recess because we're coming back into this meeting?
Nope, because we also have the attorney-client session. We have the shade meeting.
Okay.
Madam Chair, may I make?
Yes.
Thank you. I just don't want to miss the opportunity Vice Chair King brought up earlier about Preston Boland. And I don't want to go back to belabor the COVID-19, but I do want to say publicly again, a thank you, because what everyone doesn't know is that when I called him and asked him to help with his equipment and his team, he came out there and helped us. So even from the beginning of the pandemic, the behind-the-scenes work that you've mentioned. I fully realize and recognize it. I just want to say thank you for that. So
People don't
Thank you.
understand.
They don't see it.
It
yeah.
was
Yeah,
Preston
so-
going into some of our schools with his really good equipment to,
I'm saying, and he was there and
or
his
hey,
team, so.
for teachers that need a shot. I think there was a lot of coordination and relationship building, and
just a
it's
team
a good
coach.
place.
It's the
You're a
rest-
team coach.
We appreciate it, but thank you for,
Yeah.
It's just when things don't go right, then it's my responsibility.
Then you're not coaching anymore.
He hasn't said no yet. So
I know.
We appreciate it.
So real quick, on July 27th, you're going to see withdrawn the legacy, which was part of that retrofit because the funding is exhausted. And but you will see still to approve the retrofit for South Ocala.
Okay. All right, great.
Thank you.
This will be a reassessment and not an adjournment, because we are coming back into this one. She's correct. Then we will have to, after our special board meeting, we'll have to
Adjourn that.
adjourn that and then go into our shade meeting.
Okay.
And then adjourn the shade meeting and recess, or resume, right?
Okay, well, I know you'll keep me straight on. Okay, all right. And we probably should go ahead and recess this work session so that we can prepare for our special board meeting. So thank you, Mr. Bolin, and at least you didn't have to wait till after this. All right.
Thank you.
Yep. Thank you.
Thank you, Mr. Knight.
Is there any public comment on that piece? Didn't want to forget to ask. Okay, seeing none, we will go ahead and recess the work session at 11:23 a.m.